Good afternoon, and welcome to today's panel, Enlisting Volunteers to Elevate the Patient Experience. My name is Brian Heeman. I'm the Client Service Director for the Mid-America region, and I'm happy to have you here today. During today's session, our presenters from Tampa General Hospital and Stamford Hospital will share their experiences on using volunteers to assist with the utilization of GetWellNetwork at their hospitals. Many hospitals look for ancillary staff or volunteers to assist in promoting GetWell, and these hospitals have some unique perspectives on how they've used volunteers to assist in their work to help improve the utilization of GetWellNetwork. After hearing from the presenters, I'll open up the floor. I think it's always great to have some good engagement within the room here. So if you have any questions, we welcome questions. If you just have some comments or want to start a dialogue on something, we welcome that as well. I've seen some other sessions where that's worked really well. So please don't be shy, and please offer any assistance with anything that you might be doing at your own hospitals as well. It's my pleasure to begin this afternoon's presentation by introducing the three presenters here. First off, from Tampa General Hospital, we have Travis Raymond. Travis is an experienced healthcare professional with a seasoned history in engaging patients and families and supporting both clinical and non-clinical team members for over 10 years. Travis works diligently to demonstrate exemplary skills in customer service, conflict resolution, patient support, healthcare leadership, and public speaking. And the next two presenters are the co-directors of GetWellNetwork at Stamford Hospital. Roseanne Carty, MSN RN, has 30 plus years of diverse nursing experience. She has practiced as a staff nurse in med-surg, ED, ambulatory surgery, and 12 years of home care and hospice services. She has been in nursing leadership now for the past 16 years and is currently the Clinical Operations Director at Stamford Health and oversees behavioral health, acute rehabilitation, therapy services, and the Clinical Nursing Resource Department. So she has not much going on. Kelly Jones is the Nurse Manager of Informatics at Stamford Hospital. She has a BSN from Kaplan University and is board certified in nursing informatics. Kelly has been working at Stamford Hospital for 20 years, and she started her career as a med-surg nurse and moved to ICU before she became the informatics manager. In her role, she is responsible for all technology that impacts patient care and nursing services. Additionally, she teaches EMR refresher classes and reviews current data for opportunities for improvement. She's involved in regulatory reviews and helps with implementing new processes that involve technology and the clinical staff. Before we get started, I need to share the disclosure statement that you've probably heard several times. But the Maryland Nurses Association is an accredited approver of continuing nursing education by the American Nurses Credentialing Center's Commission on Accreditation. If you wish to receive credit for attending this activity, you must complete the session survey found on your conference mobile app. In the survey, it is important that you check the box indicating that you would like to receive credit and enter your full name and email address in the space provided. Your certificate will be sent to you at that email address. In compliance with the continuing education activity credit conflict of interest disclosure requirements, we'd like to announce that the presenters of the session have no commercial association that would create a conflict of interest. With that, I'm going to go ahead and turn the floor over, and Travis, welcome.
Thank you very much. Good afternoon, everyone. Hello, hello. So I just wanted to ask, I know there's some people still coming in, so feel free to come in even if you're late. We're not worried. So I wanted to see, we're talking about volunteers today. So if you look back, whether you volunteered 20 years ago, last week, 5 years ago, whether it was in healthcare, perhaps some of you are parents or grandparents helping at a school, or it's election season, so who's maybe helped at the polls. By a show of hands, who has volunteered their time somewhere, some capacity? Excellent. Thank you guys for all that you do, because we don't hear it enough as volunteers, and that's why I think it's important, so thank you. So I am Tampa General Hospital's representative. We use the saying a lot that we are TGH. And you'll see that pop up here. A lot of institutions and organizations have kind of shifted like we have recently. Who remembers the vision and the mission statements that were a paragraph long, and you can remember a couple words or one sentence? So our mission statement was 72 words. So we have nixed that, and we're starting things a little bit different. So I wanted to share with you our shared purpose. You see it pop on the screen. We heal, we teach, we innovate, care for everyone, every day. It's very simple, it's very powerful. You get the idea of what we're looking for. With that comes our new vision statement, which is Tampa General Hospital will become the safest and most innovative academic health system in America. So if that's not setting the bar high, I don't know what is. That's amazing. So definitely we have a lot to live up for, and we're looking for that world-class service, what we can provide. So here I wanted to just show you, here's our hospital, Tampa General Hospital, on a beautiful island in sunny Tampa, Florida. It's surrounded by water. It's beautiful to go out on a break, so you can go walk around the water. We are a level 1 trauma institution that has all of the usual specialties. We're 1,010 beds. We have over 8,400 team members. That is the only standalone facility that Tampa General has, but we are expanding our footprint. So now we're in the urgent care, we're also getting in the radiology center, and we're expanding that footprint into the retail spaces soon as well. So we have a lot of exciting things going on for only one acute care hospital area. We're not a big health system that's across 5 different states, so we're a little bit different from a lot of your colleagues that you've been interacting with at the conference. Let me go ahead and start the brief video. Give me 1 second. Hold that thought. Hang on. Is Christina still up here? So while we do that, I'll just share a couple more pieces. There was a little icon. We're also on the U.S. News and World Report, and we're on the honor roll, of course, and we have a lot of different specialties that we're being recognized, 5 top specialties that I'm sure most of you are familiar with. Thank you.
We come from different places with different joy, weights, and worries. Whether we struggle with a possible diagnosis or a confirmed one, whether we need insurance to cover more testing or need to pick up an extra shift, whether we agonize over life-ending decisions, or life-changing ones. Whether we happily deliver the news or happily hold the delivery. Whether we worry about becoming new parents or supporting our aging parents. Whether we celebrate first steps or next steps. Our similarities are far greater than our differences. We're all people, and at some point, we're all patients too. So let's build on our culture of caring and excellence with respect, dignity, and love. And let's recognize that better patient care starts with taking care of one another. Because we're not just like a family, we are family. And a little understanding goes a long way.
Thank you very much for letting me show you that. The reason I wanted to show you that is I think of you as internal family members. I was looking at the list of attendees as they were popping up all day. A lot of you are RNs, nurse managers, nurse directors, chief nursing officers. We have our informatics IT people. We have patient engagement, patient experience, patient care services. I watched for all of you, so you get why I shared as an internal message with you, because we're moving away from patient-centered. Yes, they're still important, but instead of that large organizational chart from top down, it's concentric circles so that we're all on the same level. That's why I wanted to show you we need to take care of each other first so that we can help our patients and our visitors. So we're volunteer specifics. I wanted to give you a quick breakdown. Patient experience, because that's what I'm representing from Tampa General Hospital. I wanted to give you an idea of how we're utilizing volunteers. Now, of course, the hospital is using volunteers in almost every area, but I'm just giving you the specifics from a patient experience standpoint. So for last year, 2019, we had 20 volunteers at our 2 different front desks. We have one in the east and one on the west. We also use a brand new ambassador program that was just launched 2 months ago, and these are those volunteers offering that human touch. From the moment you come in our organization, you're getting someone to actually take you and escort you to an area where you've never been before. We get so many people who are traveling, tourists, or even people that have not been to our hospital in 50, 60 years, and a lot has changed. So that's why we're offering that hand service from start to finish. Of course, we also have volunteers in our family lounges. You may call them your waiting rooms. It's important for them to have an idea of what's going on in the family rooms. And of course, for today, discharge phone calls. We have a call center set up in our office where we have 4 cubicles, and we have 20 volunteers who rotate throughout the week to make our phone calls with us. As Tampa General Hospital as a whole, just under 1,000 volunteers, 956 volunteers last year. I was downplaying it. I thought it was 500 to 600. I was wrong. So those individuals contributed 108,000 hours. If you look at the average, that's 110 hours per volunteer. Our usual volunteer threshold is about 60 to 80 hours. So the fact that they're doing almost double tells us a lot, that they're feeling a part of the family, they're feeling engaged, and they want to come back again and again. We put in some simple steps for successful volunteer programs. Of course, recruitment, where are you getting your volunteers from? 2, comprehensive training, and 3, that active engagement. So I wanted to just give you an idea, where are we getting our volunteers from? I'm sure a lot of you do the same thing, community-based events, different sponsored programs, sports programs, races, education programs. Volunteer fairs, we have a lot of college students. Our volunteers are anywhere from the teen summer program, and they're 15, 16, all the way to Mary, who you'll see at the end, who is almost 90 years old, and she's been with us for over 25 years. We also have able to get volunteers from other sources like former patients. Who has a strong, robust patient family advisory council at your institution? Great, who wants to strengthen it? All right, good. So that's another area where we can use those former patients who have had those experiences. And of course, social media. We always have it on our MyChart banner or whatever banners might be going across, information, having them join the program. And of course, word of mouth is huge. How many times do you hear a volunteer joining a program because Betty down the street has been there 5 years and she wants to help out and she's heard nothing but great things? So that does happen a lot. I emphasize this last piece, important to embrace a volunteer culture. I've been at some institutions where volunteers are used and they have good numbers, but they are not really feeling connected or engaged. And I think we do a fantastic job at TGH making sure that we're looping them in everything that we do. Here's an example of a rally that we had a bunch of volunteers going to the Capitol to do some unofficial lobbying, and they were very excited. We had 2 buses full of volunteers and team members to go to the Florida Capitol to kind of make their statements and share their stories. Comprehensive training, very briefly, these are pretty easy, but I make sure that I set clear expectations, that I'm very clear on the tasks at hand. I'm very good about setting goals with the volunteers, so you're coming in today for 4 hours. Let's see what you could do in 4 hours. I anticipate you to get this much done today. How do you feel about that? We have a conversation to make sure that they feel comfortable with that. You always want to make sure that you encourage a questioning attitude. A lot of these volunteers, this is their first volunteer experience. They're young, they're 18, they're 19. They feel timid, they're shy. I don't know if I should ask this. Am I going to sound stupid if I ask this? I let them know, please stop us anytime. I'll come in and round on you, check on you, make sure that we're feeling that you're comfortable, because I want you to have that environment to feel comfortable to ask those questions. Here's one of our discharge phone call volunteers. She's been there almost 2 years since we started the program, and she keeps coming back again and again. So active engagement, that's that final piece for volunteers. Be positive, that's easy. You gotta stay upbeat. We don't know what's going on behind the scenes. For the young volunteers who are experiencing a lot of the healthcare, they're very nervous. They're seeing a lot of negative effects, a lot of trauma with the family, and so they don't always know how to handle all of that stress. So you wanna make sure that you're helping them as much as you can. Ask follow-up questions. That's a good one. A lot of people to help engage. Let's say we have a new volunteer named Brittany. She starts today. She tells us she's from Colorado, where her family is, and she's excited about a trip to go to Sacramento, California. Put those pieces away in your mental file cabinet so that when she's back again next week, 2 weeks, 3 weeks, you can use those pieces to follow up. Hey, did you have your Sacramento trip? How's your Colorado family doing? Have you had a chance to go back up to Colorado? Those are good examples for you to engage with our volunteers to make them feel connected. Lead by example, easy, maybe. Celebrate the small things. I told you we set little goals for our volunteers, so when they achieve that, I'll write little notes to leave them on their desk for when they come back, give them a little gift card. Hey, I saw you did 100 calls yesterday. Excellent work, keep it up, thank you. Just a little something to let them know that someone really is noticing what I'm doing. I think it's very important. And of course, you want to show gratitude as much as you can. Whether you're the volunteer or you're the person working with the volunteer, we like to be appreciated, so we want to make sure that we do that. We do that once a year in the form of a casino night. We're giving out cash, we're giving out prizes, we're giving out gift cards, we're giving out food that always brings them by. So we enjoy doing that, and so do the volunteers. And of course, a simple thank you goes a long ways with our volunteers. Our discharge phone call program has been we started it April 1st, 2018. We created an objective that we said we will call every patient to elevate the patient experience within 48 to 72 hours after they leave our hospital in an attempt for us to resolve any residual concerns, complaints, whatever you want to categorize them as. So I wanted to give you an example. When we're calling all of our patients, we're using Rounds Plus, GetWellNetwork, and we load all of that information in there. So we want to make sure we're capturing that data. Here's a snapshot of the dashboard I see every day. It's on surveys, so I can see exactly how we're doing and how the information is coming through. Here's just some more specifics about our discharge phone call program. It's a mixture of college students, former nurses, current nurses. We have a couple physicians who have joined. We have graduate program, college students as well, people waiting to get into those professional graduate programs, vet school, dental school, pharmacy school, and of course med school. So I just wanted to give you some idea about the numbers with our discharge phone calls. So during that 17 months, not quite a year and a half, 42,000 discharge phone calls were completed, all by the volunteers. This is not a paid team. These are all volunteers. If you add up those hours, that's over 3,600 hours contributed. That is fantastic. So the idea that you can get so much work from a volunteer team is significant. I pulled that chart right out of Rounds Plus as well so that you can see that trend line. we do on average about 2,500 discharge phone calls per month. A couple months when the census is low, it's 2,000, and a couple months it's a little high, closer to the 3,000. Some of the items real quick that we're getting to catch are maybe there was a small prescription discrepancy, perhaps there was a question about their home health follow-up, maybe they had a question, hey, I think that primary doctor told me to go here for follow-up, but my discharge papers say I need to go to USF. So we help kind of align everyone to make sure they're getting successful aftercare follow-up like they should be. And of course, 90 to 95% of our calls are telling us really good feedback. They're very happy with the program. When we ask, how was your hospital stay, you're getting everything on the spectrum from okay, good, very good, excellent, the best, and Tampa General is the only place I'm going in Florida. And then that small 5 to 10% is where our areas of opportunity truly come up from. And that's where, temperature of the room, flavoring of the food, communication amongst physicians, which I'm sure you've all heard, and all of that. So I really appreciate it. I know a lot of you are in the industry, you've seen it, you've been working it 10 years, 20 years, 30 years, so I give you all a lot of credit. And here I just wanted to show you a quick picture of some of our team members, and Mary, that 90-year-old volunteer, is up front. You'll see her. She has been with the program since day one, and she keeps coming back more and more, and sometimes she'll volunteer extra hours. So it's been an excellent program. I'm happy to hear your questions afterward. And now we'll welcome Stamford Health. Here's Roseanne. Thank you.
Hi, everyone. Hope everyone's having a good time at the conference. There's a lot of great information out there. So I'm happy to be here with Kelly for Stamford Hospital, and we're presenting on our volunteer program and how volunteers can be a positive experience. A little background about Stamford Health. We are a 305-bed non-for-profit community hospital located in Fairfield County. So that's approximately between 35 miles outside of New York City. Definitely a commuter city. A lot of residents commute to New York City. So it's it's a strong community hospital. We're level 2 trauma. We are magnet designated, going for redesignation we're submitting in a month, so we're kind of busy doing that. We're also Plaintree designated, and we are a primary stroke and thrombectomy center, and actually we're going for thrombectomy capable certification next week, so we have a survey on site. We have a Heart and Vascular Institute for open heart surgery. Also, we have affiliations with several hospitals in the tri-state area. To Travis's point about mission and vision, we haven't gotten to your place where we have just a couple of words, but we definitely have also abbreviated what our mission and vision are. But I'm going to focus on the vision, which really is around being the most trusted healthcare partner for the community that we serve. Stamford Health is actually still remains an independent hospital in the state of Connecticut, where, I guess nationally, where all these large hospital systems are coming along. Stamford is committed to remaining independent, and to that means we've partnered with other hospitals, such as HSS, Hospital for Special Surgery in New York City, which is known for orthopedic surgery. We have collaborated with them, and we have HSS surgeons now who perform surgery on our 5th floor, our brand new hospital, which I had a picture of before. We also are partnered with Dana-Farber Cancer Institute for oncology patients. So, we recognize that we want to remain independent, but we're making those strong collaborative partnerships to offer our community those great services without leaving their hometown. So, the evolution of GetWellNetwork at Stamford Health started in 2016 when we built our brand new state-of-the-art 11-story new hospital, which was very exciting. So at that time, in September, we went live with GetWell Inpatient just for the entertainment mode option. Then in March of 2017, we went live with the EMR integration for medication and education. and we struggled. We definitely had low utilization initially, so we had this brand new hospital that we moved into. One nursing unit is 36 beds, but the nursing unit is actually the length of a football field, and that's considered one nursing unit. So in this large footprint, this brand new hospital, there was a lot of new technology that we adopted as well as the environment. And so GetWell kind of was one of the last things that we really hardwired and were using consistently. So we had to come as a group and think outside of the box. And to that means we saw an opportunity where we could find resources. And for those of you who are in leadership, you know that finding resources and trying to, afford what you can for new projects, new initiatives is a challenge. So we really look to the volunteer services at Stamford Health. So volunteering at Stamford Health, the community is very strong and involved. We have 671 volunteers, and it's a mix of adults and teens, similar to a lot of organizations. The junior and senior volunteers from the local high school, that's where we saw our opportunity, and we really got creative. The generation gap. If you ask any teenager out there, and I have 5 children, so I can attest to this, technology. When I need help, I turn to my kids. So, the first question, if you ask a group of high schoolers, do you ever help your parents or your grandparents? And all their heads shake yes. So we knew that utilization from a patient experience was low with the older population. They just wanted to watch TV. They were like, get this off the screen. They didn't understand it. As much as we scripted and tried to do a lot of onboarding for the patients, it was a challenge because the reality is the patients are sick and they're vulnerable and they're not thinking about learning a new technology. So we really felt that bringing in these young adults and having them be that go-between and bridging that generation gap would be our win. So I kind of skipped over, but in addition to the high schoolers, we also have an ambassador program where we assign specific volunteers to specific units. They may have an interest in oncology or cardiology based on a past experience with a loved one or their own personal experience. We reached out to our patient advisory board, which is very strong, and they were a huge resource in helping us design education for the GetWell cards that we use, and also giving us feedback about their experience when they were a patient and navigating through GetWell. So you can't beat that firsthand experience. So really our initiative surrounded the students. We knew that we needed to hone in on the students, and we're fortunate to have a really strong partnership with the school district in Stamford. So aside from becoming a part of the hospital family, the volunteers receive a lot of benefits for helping and participating. So we're always recruiting new volunteers. They actually, through the hospital, we also have that annual celebration. It's a luncheon. It's not casino night, but that's a great idea. We might have to steal that. But we definitely take them off-site and we celebrate all that they help being part of our organization. They have discounted membership to our Health and Fitness Institute. They have free flu shots. They participate in any events and lectures that we sponsor. We offer letters of reference, opportunities to join our hospital committees because we do recognize the importance they serve sitting on our committees, and participation in our credit union. And we have a concierge program as well where they are able to participate. So I think for administration and leadership, when we are lean and we're making our budgets, looking at the volunteer population as a resource and helping us to move the needle on specific things, especially patient satisfaction and just the whole patient experience, there's a benefit in tapping into this resource. And here's Kelly. She'll get into the details.
Hi, thank you all for coming. So what we've done with our volunteer partners is that every volunteer that comes through the organization has to go through a hospital orientation. So we now incorporate what is GetWellNetwork as well as using our call bells and our keyboards. So all of our volunteers get a general orientation to GetWell. We show it to them on the screen and they can touch and feel keyboards and call bells. But then we have a subset of GetWellNetwork volunteers. They get a more in-depth hands-on training. So we go over it a little bit more with them. We have a training room that we bring them to, that we let them ask our questions. We can role play for them. And actually on their first day, Roseanne or I will go in and demo one and bring them along, and then we have them. So we do a lot of teach back. What we also did with them was to create an audit tool. So not only are we having them go in and engage with the patients, but we're also collecting some data too to say, what are our staff doing? Did the patient have a keyboard? And all of that other things. So in their rounding, they're making sure that the patient is familiar with the GetWellNetwork. If they're not, their rounding, if they are, their rounding is focusing on getting them to watch the education videos, encouraging them to do their fall pathway or their discharge pathway. They'll talk to them about their med-to-bed program. If they didn't understand how to use the GetWellNetwork, they're spending additional time and they are talking to them about how to use it. Did you know, here's your keyboard, here's your pillow speaker, let's go over it again, and going from there. So this is the tool that we developed for our volunteers to have from when they round. So this is where we collect all the data. Currently, unfortunately, it's still on paper, and we input the data later. We do not have Rounds Plus, unfortunately. So, you know, that's something that we do look forward to in the future is to make this electronic so we can collect the data a lot better. At the end of the day, the volunteers are turning those forms into me, and we're following up with the nurse managers of those units. So we can say, you know, our volunteers rounded today, this is the result, you know, 10 of your patients didn't have keyboards, or, you know, 5 of the patients had keyboards, but none of them worked because the batteries were all dead. So they're doing those kind of things. They'll also go in and change the batteries on the keyboards too if they're finding those things. The volunteers also make sure that they have the patient information card in every room. We created this with our marketing and our patient family advisory council, so that every patient, even though they watch the video, people have talked to them, they still have that that piece of paper that they can refer back to. It's really helpful too for the families who came in afterwards who didn't see our intro video and have no idea what GetWell is. At least they have a reference tool for them. We've laminated these and put them in every single patient room so we can wipe them down and use them patient to patient. And we've also now included in our pre-op surgical clinic where all of our pre-op patients go. So every patient gets a copy of this as they come through the clinic so that when they do come to the hospital, they've already heard about GetWell and it's not the first thing post-op that they're learning about. With the utilization of our senior volunteers that came in, we initially had them focus on 4 units and it was over a short 4-week period of time. Overall, we saw an increase in utilization. We had an 8% increase in our safety education, and then an 8% increase in our education completion rate, which is something we always struggled with. The nurses were really good at assigning videos, but no one was very good at completing the videos. And then we actually had a 3% increase in our fall prevention pathway. It was another thing that we really struggled with in getting our patients to complete or even our staff to go in and complete. So really our outcomes show that our patients and families experience the greatest benefit from doing this. The patients really enjoyed the volunteer interaction. It enhanced the patient engagement and experience. But not only that, our volunteers got something out of it too. Our senior volunteers that we're taking are ones that want to go into the medical field. So it gives them that extra experience of interacting with that patient, not having the pressure of, oh, now this is my job and I have to interact, or this is my first clinical and I have to interact with them. But it gives them that, like, I have nothing to lose. I'm going to go in and talk to a patient. and really gets them comfortable with those interactions. I would love, at the end of the day, they come back, they'll be like, oh, this patient, oh my God, she was so cute. Especially our older adults who really struggled with, getting to use the system. Also out of this came our new patient ambassador volunteer position, which, as Roseanne stated, we are assigning specific volunteers to each unit. So they are their volunteers, so they do get more interaction with GetWell. They are in the patient's room a lot more. And really our next steps, recruiting additional volunteers for the patient ambassador positions so that we have at least one on every single unit. We have 6 high school senior interns that will be starting, I think, next month. They come 25 hours a week for 5 weeks, and they are dedicated just to GetWell and rounding on GetWell. So they are mine and Roseanne's, and really celebrating our achievements. Telling the staff what a great job they did, telling our volunteers how much we appreciate them are really like what we need to celebrate in order to keep everybody engaged. So we're gonna open it up for questions.
I see a question back there.
I was impressed with the follow-up phone calls. That's something that we've done at our hospital. Well, we've done them and we don't do them, and we've done them and we don't do them. But my question for you is, what happens with a volunteer if the question has to do with their care or a medical question?
That's an excellent question. So, of course, best practice is to use nurses to do these discharge phone calls. Sometimes we don't always have the options for that. So I'm the one to personally train these volunteers. It takes about 45 minutes to 1 hour with each volunteer. And I go over so many different examples of where it becomes that clinical muddy waters that they need to zip it and do not counsel or do not advise in any way what to do. So those ones, when they start bringing up, I'm a little confused about my wound, the discharge color has changed, or anything clinical, I have them write it down and bring it to us at the end of their 2 or 3 hour shift, and then we will divvy out, depending on which floor or unit, we will bring that up to the charge nurse. It doesn't really need to go to the nurse manager per se unless it's a severe complaint or grievance, but it's just clinical questions. We'll send it to the charge nurse. They follow up and they send us an email saying, contacted patient or daughter of patient, done. So we rely a lot on the nurses. To give you an idea, we probably utilize and send back clinical referral questions maybe between 6 and 10 times a day. It's not a lot. And depending on the different floors that we have, it's maybe 1 or 2 per unit. So it's not a lot if you break it down by floor.
Hi, I'm Ray from Lurie Children's Hospital. I was going to ask the same question. So they can navigate the chart if it is a specific follow-up question in terms of where am I supposed to go for my next appointment or things like that. Is that correct? Just not when it comes to like clinical instructions?
Good question. So we are an Epic hospital. So to get those licenses for volunteers is not an option. So there's actually never a chart pulled up as they're doing the phone calls. However, because about 99.8% of our patients report they receive their discharge papers, we say if you reference those papers, usually on page 2 or 3, it should show follow-up instructions. If you go to that, do you see anything? So we let them hold. Oh yeah, you made an appointment for my primary care physician on this day at this location. So sometimes we're using the reference materials that we provided to them upon discharge and having them circle back to it. Every once in a while, there's an area that's been missed and no follow-up was scheduled, and then that's when it comes back to our team so that we can quickly get them scheduled, get everything followed up so that they have the best success back at home. Good question.
Are they still getting the HCAPs in the mail or however you guys send that out, or is this also asking those PFE questions?
Yes, so we are also sending those random via Press Ganey for the HCAP surveys, and we do let them know on these discharge phone calls that you may receive a random survey in the mail. If you have any more feedback, we'd love to hear it on that too.
Great. And then one question for our Stamford friends. Thank you guys so much. The patient ambassador program is really of interest to me, as I feel like they cover a lot of things nurses often don't have time to do, like unit orientations and things like that. Is there a volunteer on the unit most days doing this role, or is it only, how often is that usually? Are they available?
The role is very brand new, probably only 4 or 5 months. So they are still recruiting, but the idea is that there is a volunteer there every day, and they are taking care of the little things that can take nursing back to the bedside and taking care of those patients.
Yeah. So regarding the post-discharge phone calls, so you gave some really great numbers on how many you reach. Do you know the actual rate?
Questions. I'm proud of you guys. So we categorize actual completed calls, meaning we successfully contacted the patient themselves, floats between 50 and 51%. We do 2 attempts to contact patients. That second attempt does not usually yield a big increase in successful completion. So whether we do just first calls or 2 calls, 2 attempts, we float around that 51% completed mark.
Thank you.
I had a question about another one about the phone call program. Is the scripting around that actually set up more for patient experience and service recovery, or is there actual active screening for medical and non-medical gaps?
Ours is, I would say it's more on the patient experience. Some people may use the term fluff and buff. We don't go deep into those clinical components. There is scripting that's on the screen and on paper for them. It pulls up in the Rounds Plus survey, so it's right in front of them. And we empower them to, it's more about having a conversation with the patient instead of sticking to the script and I forgot to say this and I didn't say that. It's just a free-flowing phone conversation.
And then if they needed to secure any resources like a transportation issue, financial issue, medical issue, that's basically escalated to nursing and they'll escalate it to whoever may be available to secure that resource?
Almost. It comes to our patient relations team first. So that we're the ones to kind of triage, is it a social work case management concern, financial, insurance, is it straight up clinical, is it a physician? And we'll triage it to get it to those people and expedite it, because now that we just spoke with them, we want to deliver on what we're telling you, so we want that quick turnaround literally within a couple hours.
And then for both of the programs described, it sounds like the volunteers would need to be able to have access to get, I know they don't have access to the EMR, but to GetWellNetwork, they would need a log on access, et cetera? Okay.
Correct.
Thanks.
And Travis, with your permission, I assume, and you can clarify for me after, but we do have access as client service managers or any GetWellNetwork employee to Rounds Plus. If anybody wanted to see an example of your discharge calls surveys, would that be okay?
Absolutely.
Yeah, so just contact your CSM and ask them, or you can reach out to me.
Are there any other questions? Great, thank you everyone for coming today. The expo hall is now open, so you can go ahead and go to the expo hall and look at some of the posters, but thank you to the panel here. We really appreciate your time.
Thank you. Thank you. Thank you.